Hi everyone. I have a patient of mine, a wonderful, sweet patient of mine that had cataract surgery with me twice. The first time a year ago for her left eye. In that eye, we put a toric monofocal lens, so a toric lens to give very good far vision. And I want you to tell us how you felt with your first eye, both the far vision and the near vision.
So with the first surgery where the vision was for distance, I could read, I could see things far away, but on my right eye, I couldn't see anything close. So it was only distance vision that I had at that time.
So your left eye,
Yes.
you could see far away.
Yes.
Could your left eye see close?
No.
All right. So you were missing the near vision.
I was missing the near vision, yes.
So then this year we had the option of are we going to do the same thing for your right eye? Are we going to correct the vision for far, which would require you to wear reading glasses? Or are we going to do monovision where we put the same lens in as her left eye but have one eye far, one eye near? Or, this is less common, or do we put a multifocal in her second eye? So we thought maybe we keep the left eye the same, good quality far vision, but instead with the right eye, we give far and near vision so that together both eyes can see far and then the right eye could help you read. So we put the PanOptix PRO lens in the right eye about a week ago.
A week ago.
A week ago. So tell us how you're doing. How's your experience so far?
It's been amazing. It's been a week since I had the surgery and my vision is more than 20/20, I think. And
Are your eyes
also
working well
very
together?
Well together, extremely well together. So you wouldn't be able to tell that I have one, where I can see far and one where I can see close, but they work so well together.
But your right eye sees far and close.
Yes,
Right?
that's right.
Yeah.
Yes.
So-
and I also have astigmatism, so that was corrected
Yeah.
to it.
And so I'll show you guys the auto-refraction. I didn't do a manifest refraction yet, but her far vision in both eyes is 20/20, and her near vision in the multifocal eye is 20/20, but not the toric lens. The toric lens can't see up close well, but she has very similar numbers with the two eyes. So, a lot of patients are under the impression that if you have cataract surgery and you put one type of lens in one eye, that you have to have the same type of lens in the other eye.
Yeah.
But you're a perfect example of
Yes.
how you can succeed with two different types of lenses, where I think getting used to both eyes far and one eye near
Yeah.
is easier to get used to than one eye far and one eye near, because the eyes are working better
Yes.
together.
Yes.
Whereas when you have one eye far, one eye near with monovision, we call it, there's a complete dissociation between your two eyes. But in your case, when you're doing far things, both your eyes are working together.
Yes.
And then when you're reading things like your phone,
Yes.
a text message, your computer, then your right eye just picks it up.
Yes, and it's hard to tell that, that because the way it looks like they're working in unison, both eyes, because I see well far and I see well near. So
Yeah.
they just seem to be working so
Yeah.
well. And all thanks to Dr. Pratt.
Ah.
He is the absolute best.
Thank you
The
so much.
best,
Thank you so much.
Thank you, Dr.
Thank you so
Pratt.
much.
I was
Great
telling
to-
her,